Most of us, we make health-based New Year's resolutions. It can be overwhelming for so many, and we talk to an expert about a tool that can help you if you might be struggling. 8:13 here on this Tuesday, and with the new year approaching, we all make those health-related resolutions. Well, for people with depression or obsessive-compulsive disorder, or those trying to stop smoking, even simple goals can quickly feel overwhelming. Well, joining us live in studio to talk about it a little more and some tools that could help thousands of us here in Southern Nevada who are struggling, psychiatrist and medical director at Nevada Mental Health, Dr. Sid Khurana. Doctor, thank you for being here. We really appreciate it.
Thank you for having me.
Let's talk about why now. Why is this time of year so hard for so many people?
Well, that's a great question. It's the season. We do get
the literal
winter.
Season.
Yeah, the season, and then the stress of the holidays, and then the prevalence of the condition. Depression is a very widely prevalent condition. 1 in 5 to 1 in 15 Americans, depending upon the studies, struggle with depression. And we have this new great treatment tool that can help alleviate that disease.
All right,
burden.
what is it? What's the great treatment tool?
It's called Transcranial Magnetic Stimulation. The acronym is TMS.
Okay.
And it's FDA approved for people who struggle with depression that is resistant to your usual treatment.
Describe the process. How does it work? How's it helping?
So it's very simple. You put a coil.
I know you said cranial stimulation. I figured, okay, something on your head.
Exactly.
Stimulation.
So you put a magnetic coil on your head.
Yep.
And the magnetic field changes the way your brain neurons function. And you stimulate a part of the brain that controls the part of the brain that controls the depression. And that's how you get depression to get better.
How does it work? How does it centralize? How does it find those specific spots that it needs to target? So I know we're getting into the technical weeds here, but I'm very curious.
Yeah, there is a process called mapping where we find the exact part of the brain. It's called on the left side, DLPFC, dorsolateral prefrontal cortex. Okay. We find that part of the brain connects to the deeper part of the brain which controls depression. Once we stimulate that, then it gets the brain out of the depression.
Transcranial magnetic stimulation is the process. What kind of potential changes are people going to see with this treatment?
Well, people's depression gets better, but first thing I want to say is people sometimes get scared when they think of transcranial magnetic stimulation. I just want to tell people that our brain is an electrochemical device. The brain has enough power to light up an electric bulb. So there is electricity in the brain. Wow. Electricity is the language of the brain, and we are using the language of the brain for the brain to get better.
Who could this help?
It can help people who struggle with depression that has not responded to therapy, the talk therapy, or 1 or 2 trial of medications. It can help people who have OCD, obsessive-compulsive disorder. It can help people with substance use disorders like smoking, who can't quit smoking, and we know all the bad things that happen for people who smoke. So it's just another treatment tool.
Where can people find out about the treatment tool? Where can people reach you specifically with Nevada Mental Health?
NevadaMentalHealth.com.
There you go.
Just go to our website, and it's every step. It will just walk you right through our doors and get the treatment.
Doctor, thank you so much for being here.
Thank you for having us.
Really appreciate you talking about this treatment. Thank you.
Thank you for having us.
Thank you, and happy holidays to you. All right, 8:16.